Hello, ladies and gentlemen. My name is Hwang Do-young, and this is my team member Kim Hae-sung, Yoon Jung, Do Dae-yeok, and Lee Chang-eun. Before we talk about our topic, have you heard about MERS? MERS is Middle East Respiratory Syndrome Coronavirus. In Korea, MERS diagnosis was reported first on May 20. May 20. The number of people infected with MERS is 186, and the number of deaths is 36. And if you look at another countries, the world is changed by a number of disease like SARS and Ebola virus. Also, historically, Black Death was Black Death killed most of European people. According to history books, Black Death killed 25 million European people. The result of Black Death, that the population of Europe reduced by two-thirds, and that result changed history of Europe. In example of MERS and Black Death, you can know that this is big impact on humans. So we talk about our topic is disease in detail, extremely infectious disease and high fatality disease, and finally disease that has very long incubation period. You should know about that, because in Korean proverb, 지피지기면 백전불태. Thus, if you know about disease, you can prevent disease. Also, we will include explain treatment. If you get disease, you can cope with that. So we will explain that. First, extremely infective disease, and second, high fatality disease, and finally, disease that has very long incubation disease, and each representative of disease. First is tuberculosis, in Korean, 결핵. Second is pancreatic cancer, in Korean, 췌장암. Finally is AIDS. We will explain that features, caustic gas, treatment and symptoms of this disease. My team members will explain that carefully.
Before getting started, I will introduce two concepts which are very easy to confuse. They are case fatality rate and mortality rate. These two concepts seem similar, but they are definitely different concepts. Case fatality rate is the ratio of people who died by disease to people who get the disease, and also the mortality rate, which is opposite concept of survival rate, is the ratio of people who died by disease, but its denominator does not consider the people who get the disease, but the specific population, like Korean teenagers or people who live in Jeju. Now I will introduce you the disease with low survival rate. There are many diseases with low survival rate like this, but we choose to introduce you pancreatic cancer. Pancreatic cancer is the malignant tumor in pancreas. Recently, mortality rate of pancreatic cancer is increasing, and its survival rate is about 5% in 5 years. Moreover, its frequency is doubled during 20 years. Now I will tell you about this unfamiliar cancer in 3 steps. First, the function of pancreas. Pancreas is the organ which is placed behind the stomach, and its length is about 15 centimeters. It secretes pancreatic juice, which have many digestive enzymes that break carbohydrate, protein, and fat. And also it secretes some hormones like insulin and glucagon that control the blood sugar. If you get the pancreatic cancer, these functions will not work well. Second, the symptom of pancreatic cancer. Most of the patients show stomachache and loss of appetite and losing their weight and digestive problem. These symptoms are too common so that people can ignore easily and make the disease more worse. Since pancreatic cancer does not cause noticeable symptom in its early stage, this disease is typically not diagnosed until it spread enough. This is the main reason of low survival rates. Moreover, pancreatic cancer is hard to cure than any other cancers when it goes on. So the best way to avoid this cancer is to find this disease as early as you can. Therefore, taking medical checkup periodically is very important. Finally, is the treatment of pancreatic cancer. Like other cancers, there are 3 representative treatments in pancreatic cancer. They are surgery, chemotherapy, and radiotherapy. Removing malignant tumor by surgery is the most effective way to cure the pancreatic cancer, but 70 to 80% of patients are not suitable for surgery because of its spreaded cancer cell, so the chemotherapy is needed. Chemotherapy is a method that using anti-cancer medicine, and it used to control the remaining tumor after surgery, or help patients who are not suitable for surgery to extend their life or improve their life's quality. The last one is radiotherapy. Radiotherapy is a therapy that uses high energy radiation, as you can see in its name. The radiotherapy and chemotherapy are used at the same time mostly. Thank you.
Before introducing the strong infectious disease, I will tell you the definition of the word infection and relevant information. The infection word is the case that pathogen moves from the source of infection to other hosts by physical contact or other carriers. And pathogen is microorganism that cause disease like virus, bacteria, and or fungus. During this infectious process, there are some kinds of route that pathogen moves. This is called the route of infection. In route of infection, there are direct infection and indirect infection. In direct infection, there are contact infection and droplet infection. Contact infection is literally means the pathogen moves by physical contact or other objects that is contacted. And droplet infection is the case that drumlet when you talk, cough, sneeze, fall to the ground and consequently lead the transmission and physical contact infection. In fact, the diameter of drumlet determines its state. If it is over 5 micrometers, the drumlet is relatively heavy to fly and fall to the ground. However, if it is under 5 micrometers, the drumlet could float through the air and thus could spread to the airflow. This is especially called aerial infection. And in indirect infection, there are transmitting objects and transmitting animals. Transmitting objects could be polluting water, food, or ground. And transmitting animals are typically fly, mosquito, mite, or flea. Among these infections, the most dangerous route is aerial infection, because it is hard to understand the route of infection and the speed of spread is very high, and it could lead to further contact infection and transmission. Therefore, today now I explain about tuberculosis that is transmitted by an aerial infection that is widespread throughout the world. And now I will say TB instead of tuberculosis because this word is too long. Actually, TB killed the largest number of people since it appeared. Although its trace is found at Neolithic fossils, but it is well known in 1882 when German bacteriologist Robert Koch found its pathogen that is Mycobacterium tuberculosis. And TB transmits directly by people's tiny spit or drumlet. Around 30% of people that contact this are infected, and 10% of those experience the outbreak of TB. You might think this figure is relatively lower than your expected level, but think of a metropolis that has a large population. The high population density could accelerate the speed of TB spread by easy human-to-human transmission. And also, if I compare TB to MERS, which is another example of aerial infection, the symptoms of MERS is definitely different before and after the outbreak. On the other hand, the symptoms of TB has not much difference before and after the symptoms, and it tends to get worse as time goes by. Thus, it's hard to control the spread of TB because the patients usually don't know that they are infected. As I mentioned earlier, TB is not always outbreak when they are infected. So it is not desirable to relax when they are infected, but it is not outbreak. Another feature of TB, except aerial infection, is the latent infection that lasts for several weeks to several months. If you are healthy, there is no outbreak and no infectiousness. But when you are not healthy or your immunity system drops, then TB can outbreak. In fact, WHO says that 1/3 of world population are latent infected of TB. And Korean Disease Control and Prevention Center also estimate the similar level. That is, the TB is widespread throughout the world, and the transmission of this is ongoing process. You might have fear about this information, but don't worry about that. So this tuberculosis is very strong infectious disease, but its history is very long compared to other disease, and it is studied a lot that WHO states that tuberculosis is curable and treatable disease. However, be careful not to ignore the possibilities of TB and not to take medicine irregularly when you are infected. If you experience cough or fever or lack of appetite or weight loss, you should take physical examination. And even if you are infected by TB, you could use combination therapy, which means use various kinds of medicine at the same time. Using this process, you can prevent mutations that have tolerance to these many medicines. Usually, patients use 4 kinds of medicine at the same time for 2 months, and another 3 kinds of medicines for 3 to 7 months. It is different about the people. So now, tuberculosis is being forgotten by people because of systematic management of nation and improved quality of life. It is still noticeable infectious disease.
In this part, I will introduce one disease that has the longest incubation period. Incubation period means the time from the moment of exposure to an infectious agent to signs and symptoms of the disease appear. In Korean, it is 전복기. Incubation period is determined by a lot of factors. However, there is 4 main factors determining incubation. One is dose or inoculum of infectious agent. And second is route of inoculation. And third is rate of replication of infectious agent. And final is post susceptibility and immune response. Now look at this table. According to this table, incubation period most disease incubation period are between 12 hours and 42 days. However, HIV and cruel disease has the long incubation period. Cruel disease has the longest incubation period. However, it is not common because it is restricted to native birds who ate the brain of dead people as a funeral ritual. So today I will introduce HIV, also known as AIDS, especially about three information matter of AIDS: progress of symptoms, prevention, and treatment. Incubation periods of AIDS is 10 years old. It is explained by three stages of HIV infection. First, in initial infection, stage 1, a person may experience a brief period like influenza illness, such as headache, a sore throat, and fever. A second stage is prolonged period without symptoms. In this stage, infection progresses. It interferes more and more with immune system, making people susceptible to common disease. The last stage of infection is AIDS, acquired immune deficiency syndrome. In this stage, because of deteriorated immune system, minor disease of healthy person became fatal. Now I will talk about prevention of AIDS. AIDS is infected by HIV, so you should be careful not to expose it to infected root of HIV. For example, you should avoid having sex with random people. Moreover, pregnant women with HIV need an injection of anti-HIV. Then, is there a clear solution to AIDS patients? Unfortunately, there is no cure or vaccine of AIDS. However, antiretroviral treatment can slow the course of disease and lead near normal life expectancy. While the antiretroviral treatment can save the people, this medicine is very expensive and have a lot of side effects. So it is important to have a treatment as soon as the diagnosis was made.
Today, we introduced three interesting diseases: pancreatic cancer, tuberculosis, and AIDS. And now, I will summarize these diseases lightly. These diseases have each own characteristic. First, pancreatic cancer is one of disease with low survival rate, and it is too hard to recognize because it just have common symptoms like a stomachache. And third, when it is detected, and it is already inevitable. Second, tuberculosis. It is a strong infectious disease and aerial infection disease. Also, its initial symptoms is too slight. Lastly, AIDS. It infected by HIV, and its incubation period of it is about 10 years. It is much longer than other disease. End of presentation. Some of you think that, oh, that disease is so awful, but I'm okay. I will not get that disease. But not. You are not. You are not okay. You should not be released because there are so many types of disease risk elements, and we live in. Don't be relieved, and you prevent disease yourself. Thank you for listening.